Okay, now coming on to a very important topic, how to localize an object in 3 dimension, right? So we have several, or I should not use the term several, two main important techniques called as object localization techniques, which help in localization of object in 3 dimensions, right? And these object localization technique is for conventional radiography, where we see 2-dimensional image of an object. Otherwise, the best way to localize an object is to visualize it in CBCT, right? If you take an CBCT of an impacted tooth, you can easily localize that tooth because it is a 3-dimensional imaging modality, right? But if CBCT is not available, in conventional radiography, if you would like to localize an object, what techniques can you use? That we will talk right here, right? First of all, let us see what are the indications of these object localization techniques. When do we need to localize an object, right? So, in cases of impacted tooths, we need to localize this impacted tooth. If there is presence of a supernumerary tooth, we need to localize it using these object localization techniques, right? If any foreign body is present, again we would like to localize it, right? So that we know exactly where it is. In cases of any broken needles, we need to use these object localization techniques, right? Sometimes some soft tissue calcifications confuse us, so in that case, again, you need to use these object localization techniques, right? Sometimes there are sometimes to differentiate between a periapical pathology and mental foramen, you need to use these object localization technique. In endodontics, if there is any broken instrument, extra canal, sometimes you use these object localization techniques. So these are the main indications when these techniques are required, right? Now let us see what are these techniques first of all. So let us see the object localization techniques. We have two main object localization technique. I repeat, we are talking about conventional radiography because in 3D imaging like CBCT, it is easy to localize, right? In conventional radiograph, the two important technique are, the first one is called as right angle technique. The second is called as slop technique. So we have right angle technique as well as slop technique. First of all, let us see what is the right angle technique. In right angle technique, if by right angle technique, if we have to localize an object, what we do is we take one IOPA first. When we take this IOPA, which is a 2-dimensional image, right? What dimensions can we see here? We can see vertical and horizontal dimensions. That means we can see that superior inferior dimension as well as the mesial and distal dimensions, right? We cannot see what? Buccolingual dimension. You cannot see the buccolingual aspect of that the buccolingual dimension, right? So where do you see this buccolingual aspect of a tooth, or buccolingual aspect? Where do you see this? We see it on the occlusal radiographs. You know that occlusal radiograph shows buccal as well as the lingual areas, right? So if you want to localize an object in 3 dimension, use this right angle technique, where in IOPA you can see the superior and the inferior aspects, mesial and the distal aspects, and in the occlusal radiographs you can see buccal as well as the lingual aspects, right? So you can see all the 3 dimensions, right? And thus it is easy to localize that impacted tooth, supernumerary teeth, foreign body, etc. Whatever you want to localize, right? Next we will talk about this slop technique, right? Starting with this slop technique, first important thing is to know the different names of this technique, right? So one we have already talked about, that is the slop technique. Slop stands for same lingual, opposite buccal. Same lingual, opposite buccal. That means when we shift the tube in a particular direction, if the object in question also shifts in that direction, it is lying lingually because it is same lingual. But if we shift the tube in one direction and the object in question moves in the opposite direction, then that means that object is lying buccally because it is opposite buccal and same lingual, right? This is slop technique, also called as slop rule, right? The slop rule is also known by another name called as Bama. What is Bama? Like slop, Bama means buccal always moves away. Same thing, same lingual, opposite buccal. Similarly, it is Bama, buccal always moves away. Buccal is always, like opposite is buccal. So buccal always moves in the opposite direction. So remember what is slop rule and remember what is Bama rule. However, there are 3 more important names to this slop technique or slop rule, right? One is tube shift technique. That means slop rule or slop technique or Bama technique is also referred to as tube shift technique, also called as Clark's rule, also called as buccal object rule, also called as tube shift technique, Clark's rule and buccal object rule, right? They are the various names of this Bama or slop technique, right? So let us see what does this tube shift technique or Clark's technique or buccal object rule or slop rule or Bama rule says. Here we take 2 radiographs, that is IOPs. We take 2 IOPs here, right? First radiograph we take normally, right? Suppose I want to localize an impacted canine which is present somewhere in the premolar region, right? So first radiograph I will take normally of that impacted canine which is present in the premolar region. But when I am taking second IOPA, what I did was, or what I will do is, I will shift the tube. Now suppose I will shift this tube, suppose I am shifting the tube distally. So the second radiograph I have taken by shifting the tube distally, right? And when I have shifted the tube distally and then I have made this radiograph, and now I will put these 2 radiographs on the viewer box and now I will see the difference. If this impacted canine which was present in the premolar region shifts towards the second premolar or towards the molar. That means it is again shifting distally. If the tooth shifts distally, that means that tooth is lying lingually, because same lingual opposite buccal, right? But when I shifted this tube distally in the second radiograph, if that tooth would have moved mesially, that is, it was lying in the premolar region, but now it moved towards the canine region, that means it is not lying lingually, that means it is lying buccally, because same lingual and opposite buccal, right? Slope or Bama, that is, buccal always moves away. I hope I have explained this to you in a very easy language, right? Always remember the term tube shift, right? The direction of tube shift is very important, right? Also to remember that if you will shift the tube distally, that means that the central ray is directed mesially, right? Because when you are, suppose this was the normal position and like this you have shifted the tube distally. If you shift the tube distally, the central ray is going mesially, right? So again, important point here is, do remember the language of question. If the question says, here just pay attention to this thing, if the question says that in the second radiograph, when tube was shifted distally, the impacted tooth or impacted canine moved mesially. That means this impacted canine is lying buccally, because it moved in the opposite direction, right? But here, if the language of the question changes, and they say when rather than tube was shifted distally, central ray was directed distally, the impacted canine moved mesially. So that means it is not lying buccally, that means it is lying lingually. Right? When the central ray was directed distally and impacted canine, the tooth in the question moved mesially, that means the tube was shifted mesially only. Because when you will shift the tube mesially, then only the central ray will be directed distally. Now this is very important. So do understand the language of the question, right? The object should move in or opposite the direction of tube shift, right? They are not using the word tube was shifted here. They are using the term central ray was directed distally. If the central ray is directed distally, that means tube was shifted mesially. That is why the central ray was directed distally. So that means tube was shifted in the same direction where this impacted canine moved. So same as lingual, right? But if the question was previous one, that tube was shifted distally and then the canine moved mesially, then yes, it was buccally, right? So this is what is slop technique, this is what is Bama technique, this is what is tube shift technique, Clark rule or buccal object rule. Carefully see that what they have asked, what the question has asked, and then answer the questions related to this technique. So usually they say the best way to localize an object in conventional radiography is take 2 IOPs by slop technique and also take 1 occlusal radiograph. So when you take 2 IOPs and 1 occlusal radiograph, that means if you combine both right angle as well as the tube shift technique, then it is easy to confirm at what side the object is lying, and it is easy to localize that object then.